Well, it's not magic, this medication, but with the right tools and mindset, you can achieve a healthier lifestyle. Eric Stanek, Chief Medical Officer of DoctorsNow, is here to talk about their medical weight loss program, which does include medications like GLP-1s, although really a focus on wellness, nutrition, diet, even sleep.
Yeah, that's the first talking point that we have with all of our patients that are on the program, is starting with the foundations of health and wellness, which is your nutrition, your physical activity, and your sleep. Nobody's going to really have success in losing weight if they don't focus on those things first and foremost. The medications that many patients on the program use, but not all, are just there to help on the nutrition side of things. But ultimately, you focus on the foundations of health and wellness first, and then you build from there.
Yeah, I think we've talked before. Is sleep, is that one of the hardest things that people struggle with?
I think it's all of them.
Okay.
If you're not somebody who prioritizes nutrition, if you're not somebody who prioritizes physical activity, or somebody who prioritizes sleep, those are, you need to make some changes in your habits if you're going to sustain those things over a long period of time. Ideally, you want to keep those things with you forever. You want to make some changes while you're on, a weight loss program such as ours, or any other sort of weight loss or nutrition or exercise program that you're on. But then you want to carry those habits throughout the rest of your life, because you're not going to be on one of these programs forever, but you want to maintain healthy habits for as long as possible.
Okay, GLP-1s, we've talked about those before. I guess, what are those and how can those really help with your nutrition?
So if you start from the foundation of nutrition, exercise, and sleep, the part that the GLP-1 medications like semaglutide, a lot of people know those as Ozempic or Wegovy, or tirzepatide, a lot of people know that one as Mounjaro or Zepbound. The thing that those really help with is on the nutrition side, and specifically on total calorie intake. They just help people not be so hungry all the time. And they slow the movement of food through the stomach and the intestines so that people are just generally eating less every meal than they normally would. And it helps people to go into a calorie deficit. So it's really a really simple equation that people want to think about. If you want to lose weight, you have to burn off more calories every day than you're taking in. So long as you're in a calorie deficit and you're able to sustain that over a certain period of time, you will lose weight. You just want to make sure that you're doing it in the right way. So that's the part that these GLP-1 medications like semaglutide or the so-called dual peptide medications like tirzepatide help with. They help people take in less weight. The medications aren't going to exercise for you. They're not going to sleep for you. You still have to make a conscious effort to incorporate those things into your life in a healthy way. But that's how people should think about how these weight loss medications fit into their overall health and wellness program.
Can it especially help people if maybe they feel stuck and they're not seeing progress, even if they feel like they are eating the right things and doing the right things?
It's the most common story that we get for people who come into our program, and almost all of those people are able to lose some weight successfully, usually with the assistance of some of these weight loss medications. But it still goes back to the same basic principles, which is you gotta take in less than you're burning off every day. One thing that we offer at DoctorsNow is in-body body composition scanner, and not only does that show you your total body fat, subcutaneous and visceral fat, lean muscle mass. A lot of people are familiar with what those are, but it also shows you what your basal metabolic rate is. And your basal metabolic rate is, if you were to lay in bed and do nothing all day for a full 24-hour period, how many total calories does your body burn at rest? It gives people a really good insight into what their calorie count should be every day. And for the most part, whatever your basal metabolic rate is, your calorie count should just be slightly over that. And then if you're able to stack some good, some quality sleep and physical activity regularly, you'll be in a calorie deficit most of the time, and you sustain that over some time and you'll lose some weight.
And that helps people kind of track their progress too when they come see you.
Yeah, because most of our patients come see us every 4 weeks because we want to make sure that people are maintaining their lean muscle mass and that the weight they're losing is the bad weight. It's the subcutaneous fat, which is the fat that you see in the mirror. It's in the gut, it's in the hips and the thighs. And then there's the visceral fat, which is fat that you don't see in the mirror, but it's not so good for your metabolic health. That's fat that gets stored in and around solid organs like your liver. So if people have heard of fatty liver before, that's visceral fat. We want to make sure that when people are losing weight, they're maintaining their lean muscle and they're losing their subcutaneous fat and visceral fat. This has huge implications on both quality of your life and how long you live.
Well, thank you so much for sharing this with us. We
Yeah.
appreciate it. And for more information and to schedule an appointment, you can go online to doctorsnow.com/medical weight loss or call 515-514-1259. You can also send inquiries to the email address you see on your screen. You'll find the weight loss program located in West Des Moines, and you can see more on social media.